Every home health visit tells a story. A strong home health visit starts long before you knock on the patient's door and continues after you leave the home. Strong preparation, consistent infection control, and clear clinical reasoning not only improve outcomes but also protect the agency during audits and surveys. Today, I'm breaking down exactly how to prepare for and perform a home health visit in a way that supports patient outcomes and protects your agency. Let's get started. Pre-visit preparation. Before a home health nurse ever steps into a patient's home, the real work starts the day before. This preparation sets the tone for safe, efficient, and compliant visits. Mental preparation and documentation review. Log into the EMR to confirm visit purpose and type. Confirm that you have all the needed forms and consents where needed. Review care plan interventions, goals, skilled needs, and measurable outcomes and parameters. Check if there are priority patients or time-specific visits. Check if any patients need specific supplies, such as wound care supplies or lab kits. Check for recurring skills and when they were last performed, such as monthly Foley catheter changes, weekly labs, hemoglobin A1C, etc. A well-planned schedule helps avoid unnecessary backtracking and ensures timely care. Chart review for each scheduled patient. Carefully review the patient's record to verify referral source, physician orders, and visit frequency. Identify active diagnoses, comorbidities, allergies, and skilled needs. Review recent hospitalizations and prior visit notes such as history and physical, discharge summaries, ER notes, current medications, any new or pending orders, and wound photos or measurements from prior visits. Review safety concerns noted by other disciplines. This review helps the nurse anticipate what to expect clinically before arriving at the home. Checking for order clarifications. If anything in the chart needs clarification, such as wound care orders, medication discrepancies, or missing frequencies, message the physician, coordinate with other disciplines involved in patient's care, confirm supplies ordered, or per your agency protocol. Resolving issues before the visit prevents delays and protects compliance. Preparing the nursing bag and restocking supplies. Stock and sanitize the nursing bag per agency policy. Calibrate equipment needing calibration. Replace used supplies. Repack wound care materials. Check sharps container. Ensure PPE is stocked. Clean equipment such as stethoscope, thermometer, pulse ox, glucometer, etc. This prevents scrambling the next morning. Logistics, safety, and patient communication. Confirm patient availability and address. A quick call or text may be sent to confirm the visit time. Remind patient or caregiver to have medication bottles ready if able to. Ask caregivers to be present when needed. Ensure pets are secured. Assess neighborhood and environmental safety considerations and plan visit sequence to optimize time and reduce missed visits. This is also the time to verify homebound status, skilled need, and any risk factors you must evaluate during your visit. The day of visit. Check for any communication from the agency to ensure no cancellations, rescheduling, rehospitalizations, new or changed orders from the physician. Travel time and deficiency. Travel is part of the job. A home health nurse may see anywhere from 4 to 6 patients a day, depending on the agency, patient's acuity, and visit type. Map out your travel to ensure no roadblocks or constructions along your travel path to avoid traffic and delays when possible. Arrival and professional introduction. A typical visit begins with a friendly introduction and infection control protocol, hand hygiene, bag technique, and ensuring a clean workspace. Perform hand hygiene before entry, introduce yourself, and ensure name tag is visible. Verify patient identity and explain the visit purpose. Obtain consent for care and ensure patient comfort and privacy. Establish rapport while maintaining professional boundaries. Infection control and bag technique. Place bag on a clean, firm, and dry surface away from pets and children. Do not place bag on the floor. Place bag on an impermeable disposable barrier, such as chucks. Perform hand hygiene and place needed items on the clean barrier pad. Separate clean versus dirty supplies. Perform hand hygiene before and after care. Disinfect reusable equipment with an agency-approved sanitizer cloth following the product manufacturer's instructions. Return only cleaned and disinfected items to your bag. Place any reusable items that cannot be cleaned and disinfected while in the home into a sealed, impermeable plastic bag. Place this bag in the container marked for soiled items in your vehicle. Clean and disinfect your bag thoroughly when soiled and according to your agency's policies and procedures. If your patient is on isolation or home is infested, take only essential items to be used only for that visit and follow your agency protocol as it applies. In-home assessment and skilled care. Assess. Vital signs and pain assessment, cardiopulmonary and system-specific assessments, functional status, fall risk, and home safety. Assess for clutter or fall hazards. Perform medication reconciliation using actual bottles and assess for unsafe medication storage. Assess for nutritional concerns. Perform psychosocial and caregiver assessment and check for signs of neglect or caregiver strain. And any other assessments required per your agency policies, care plan, orders, and EMR questionnaires. Perform ordered treatments and skilled interventions. Observe and document patient response. Perform patient and caregiver education on disease process management, medication purpose and side effects, safety and infection prevention per plan of care and skilled need, and based on assessment findings as needed. Identify red flags requiring MD notification. For medication reconciliation, check for new prescriptions, discontinued meds, duplicates, drug interactions, missed doses, side effects, and patient-caregiver knowledge of the medication. Patient and caregiver education. Education is one of the biggest skilled needs that justifies home health. Ensure teaching covers disease process management, any warning signs or red flags, medications, when to call the nurse or physician, diet and lifestyle considerations. Every intervention must tie back to the plan of care and support the patient's goals and medical necessity. Wound care. Wound care typically includes removing old dressing, assessing drainage, color, odor, depth, tunneling, and size. Measuring wound, checking for infection indicators, performing ordered dressing change, reinforcing patient and caregiver teaching, updating photos if permitted, and documenting changes in condition. The nurse must clearly document skilled need, progress toward healing, and any concerns requiring physician notification. Visit wrap-up and documentation. Before leaving, review what was done, reinforce next steps, confirm next visit if known, provide agency contact information, and remind on the availability of the information in the patient's folder in the home, especially if visit is an initial visit. Home health requires strong time management. Many nurses use the car as a documentation station between visits. This is the perfect time to finish documenting the last visit, message or call agency case manager and the physician to notify of changes and concerns if needed, complete care coordination and communication notes, communicate changes to the whole interdisciplinary team, upload wound photos, and prepare for the next patient. Timely documentation protects you, the agency, supports compliance, and ensures accurate billing. In summary, the home health visit flow is as follows. Prepare, assess, intervene, educate, document, communicate. When documenting, always keep the medical necessity in mind. Address all issues assessed, ensure skilled need is tied to the primary focus of care goals and the plan of care. Goals are measurable, patient's response to care is documented, and all interventions and communications done is reflected in your documentation. Avoid generic documentation, copy and paste notes not customized to each patient, and avoid delayed documentation to avoid omission and confusion. Communicate to MD, abnormal vital signs, worsening symptoms, new wounds or infections, medication discrepancies and falls or safety issues. Remember, if it isn't documented, it didn't happen. Your home health visit is not just a visit, you're teaching, empowering, advocating, and helping your patients regain independence and stay safely in their homes. Thanks so much for watching. If you found this video helpful, give it a thumbs up. It really helps others find it too. Don't forget to subscribe so you don't miss out on more tips and resources. Looking for easy-to-use digital tools for managing home health? Check out my Etsy shop. Link is in the description. If you have questions, ideas, or want to share your experience, leave a comment. I'd love to hear from you, and feel free to share this with anyone who might find it useful. See you in the next video.